Great. Today's presentation is titled Integrating Trauma and Violence-Informed Principles in Assessing and Responding to Family Violence. It is with great pleasure that I introduce to you our speakers for today. Angelina has been serving in public health for over 25 years. In the past, she has worked in different programs related to child and family health. She has coordinated the trauma-informed care staff training in her workplace. Currently, she provides resiliency skills staff training and focuses more on best practices related to family violence. Other than her work life, Angelina lives with her husband in Toronto and has 2 adult children. She enjoys traveling, hiking, and continuing her professional studies in both mental and spiritual health. And we also have Naomi. Naomi is a public health nurse with York Region Public Health. She is the team lead on the Healthy Babies, Healthy Children program. Naomi is the co-lead champion of the Family Violence Best Practice Guidelines. She holds a master's degree of public health. Naomi lives with her husband and children in Caledon, Ontario, where she has a dog and 6 chickens. Welcome, Angelina and Naomi.
Thank you.
Thank you, Bethany.
Thank you for the warm welcome, and thank you for taking the time to join us today. Angelina and I will be presenting on integrating trauma and violence-informed principles in assessing and responding to family violence. We can do the next slide. Okay, so we wanted to highlight that York Region's Child and Family Health Division is an RNAO Best Practice Spotlight organization, and this designation is something that we're really proud of. For this presentation, we will be highlighting our work with implementing the BPG woman abuse, screening, identification, and initial response. At York Region, we're taking a trauma and violence-informed approach to our work and using more inclusive language. And so for this reason, we've relabeled this BPG as family violence. So this provides an overview of our presentation. We will be discussing the statistical significance of family violence within York Region. We will review our gap analysis that was completed and the opportunities that came from it. An overview of both the trauma and violence-informed principles and the Vega Project online platform will be given. And we will also be discussing how the practice of assessing and responding to family violence has changed at York Region Public Health. So the next few slides, we're going to look at York Region specific data to highlight why addressing family violence is so important. So this slide is data from York Region Police that shows the high and increasing rates of both intimate partner violence and family violence. And it's looking at a time range from 2018 to 2022. In 2023, York Region declared an epidemic of intimate partner violence within its border, with over 6,000 incidences reported in 2022. And so Bethany will do the poll here.
Yeah, before I share our work in gap analysis, I'm curious to know the current practice in the community. So can Bethany or Angia get the poll about usual practice in recognizing family violence? Yes. So what is your usual practice in recognizing family violence? Is that the routine universal comprehensive screening or the indicator-based approach? Let's do the poll. Wow, amazing. So we can end it, Bethany or Angie? Okay, so seems like that we have 60% of people doing the indicator-based approach and 40% doing the routine universal comprehensive screening. Wonderful. That's nice. Okay, so let's continue. Let's start our journey. So let's start our roadmap first. So our journey actually started with a gap analysis we conducted in 2022 on our current practice in screening family violence, together with a brief literature search on current evidence base related to assessing and responding to family violence. We found that there was a huge gap between our practice and the recommendations from new evidence-based research. So let's see what is our gap analysis tells us. So that is what we found. Let's see. So during the past few years, more and more evidence-based research, including those from the World Health Organization, WHO, show that the routine universal comprehensive screening is not effective in reducing intimate partner violence nor helping those clients who are in abusive situations. WHO papers found that even though health practitioners are able to identify the IPV cases, often the support after disclosure is not enough or may cause more harm to the clients. Rather, indicator-based inquiry is recommended. On the other hand, the emerging concept of trauma and violence-informed care, or TVIC for short, provides a better approach and service to clients based on not only realizing the impacts of family violence as a trauma, but also the impacts of intersecting the assessing of different social determinants of health under structural violence and inequities. TVIC actually demonstrates a better service in harm reduction with empowerment for clients. Let's continue our road path and identify a potential resource. Since RUST screening is no longer an appropriate approach, to maintain our best practice standard, we went searching for a new evidence-based resource to equip our staff for new practice. We noticed that a new family violence resource was rolled out by VEGA project during the pandemic. VEGA stands for Violence, Evidence, Guidance, and Action. VEGA project was funded by Public Health Agency of Canada to create resources for service providers in recognizing and responding to family violence. VEGA project applies trauma and violence-informed care and promotes the indicator-based phased inquiry. Our QA and CQI team then did a critical appraisal on the literature references on VEGA family violence resources. In addition, a content appraisal was completed to ensure that it meets our staff needs and matches our both departmental and divisional messages. After completing the process of validation and revisiting the gap analysis, our management team agreed to make changes and adopted VEGA family violence resources into our practice. The Family Violence BPG project then opens a new chapter. Now, here are the changes recommended in the opportunity summary. The first step is to practice change by applying trauma and violence-informed care to family violence BPG and switching family violence screening from routine universal comprehensive screening to indicator-based phased inquiry. Second step is to adopt VEGA education resources as a divisional mandatory online family violence education curriculum. Next is to develop divisional policy with application of dual screening approach to assessment tool and also documentation system. The last but not the least is to build in co-champion structure with a 3-year work term. In that case, we can involve BPG work among different teams. At the same time, the momentum of best practice will keep rolling while new ideas can be generated from different lead champions. Naomi, we can see the project timeline.
Okay, so now we're going to be looking at the BPG project timeline. So this timeline provides an overview of our work starting from conception in April 2022 to where we are now, as well as our future plans. All child and family health staff were trained on the indicator-based phased inquiry approach for assessing for family violence using Vega's online platform in the summer of 2023. We will go into more detail about the Vega project in a moment. We just finished offering Vega follow-up sessions to our frontline staff. These sessions were put on by York Region and Vega staff. At these sessions, staff were given a chance to practice their assessment and communication skills by role-playing. York Region specific resources were also reviewed at these sessions. And currently, we're in the process of updating our guidelines and policies, as well as our documentation forms. As you can see on the slide, we are planning for future evaluations of staff knowledge as well as confidence. And we're planning for more collaboration with our community partners.
Now, we have our title as Integrating Trauma and Violence-Informed Principle in assessing and responding to family violence. So what does trauma and violence-informed care means? Is it the same as trauma-informed care? Now, due to the time constraint and the nature of this webinar, I can only provide a brief introduction of TVIC here. However, I do include the information of our website at the last slide about the additional resources. That is the Gender, Trauma and Violence Knowledge Incubator at University of Western Ontario. That site has different resources and links about TVIC. So please make sure you go through that site later. So why do researchers add a V to TIC and make it to TVIC? Nadine Wathen and Colleen Valco in their new book, Implementing Trauma and Violence-Informed Care, a Handbook, state that trauma and violence-informed care expands the concept of TIC to account for the intersecting impacts of systemic and interpersonal violence and structural inequities, including stigma, discrimination, and bias on a person's life. TVIC recognizes interpersonal violence is a form of trauma. It is nice that nowadays we apply trauma-informed care to those who suffer from that violence. What we may not realize is that these vulnerable people are also facing ongoing systemic and structural violence in their daily life. This form of violence is built in our political and economic system. It creates inequitable distribution of social determinants of health that cause harm to people. That is social injustice, like poverty, unconditional bias, stigma, racism, and sexism, etc. All these different forms of violence can increase risk of multiple forms of trauma. Let me give you an example. A client who has just been hit by her abuse partner decides not to attend a scheduled training that's supposed to equip her to find a job. This kind of no-show has happened a few times. The service provider eventually labeled this client as non-compliant and follows the regular procedure to note the status as failure to complete the training. There is no follow-up with this client. In this case, the service provider becomes the perpetrator and adds more harm to the client. even though the action is not intentional. In conclusion, the lens of TVIC broadens service providers' perspective on how interpersonal violence intersecting with structural violence causes additional impact of trauma to people who are already vulnerable accessing social determinants of health. So let's see the TVIC principle. In TVIC, the disclosure of violence is not the goal of the service, but rather to empower clients through a trusting relationship in addition to strength and capacity building strategies. There are 4 interrelated principles of TVIC, and they involve both organizational policy and individual interaction. I'm going to explain a bit the organizational level. Later on, you will see the application of individual interaction in the Vega Family Violence Resources. The first principle is understand trauma, violence, and its impacts on people's lives and behavior, such as build in policies and processes to facilitate the organizational culture of structural competency, provide staff training on health impacts from trauma and violence. The training needs to involve both management and any staff who provides direct client services, even a receptionist. Second principle is create emotionally and physically safe environments for all clients and providers, like create welcoming spaces and signages, collect clients' input, establish peer support and self-care programs for staff who are at risk of burnout. The third one is foster opportunities for choice, collaboration, and connection. Example could be have policies and culture on shared decision-making, involve service users who input in planning and implementing programs. The fourth one is use a strength-based capacity building approach to support clients. Example as allow staff to have sufficient appointment time to engage with clients, or provide some flexibilities in modifying programs to meet clients' contexts and needs. Now let's see what is the Vega project.
Thanks, Angelina. So now we're going to review the Vega project in more detail. So Vega, which stands for Violence Evidence Guidance and Action, has created evidence-based guidance and education resources to assist both healthcare and social service providers in recognizing and responding safely to family violence. We wanted to quickly review the data that Vega used to guide the creation of their online platform. They found the research showed that although screening increased identification, there's no evidence to support screening for IPV in healthcare settings, and screening actually showed no improvement in IPV or health outcomes. Research also highlighted the need to be alert to signs, symptoms, and risk factors of intimate partner violence. Vega developed these resources with the funding from the Public Health Agency of Canada in collaboration with 22 national organizations. And Vega focuses on 3 main types of family violence. So child maltreatment, intimate partner violence, as well as children's exposure to intimate partner violence.
Right. So Vega Family Violence Resources is a self-paced online curriculum. There are 3 modules. The first one is knowing about family violence in Canada. The second one is learning about creating safety that is related to TVIC. The third one is learning about recognizing and responding safely to child maltreatment that include children's exposure to intimate partner violence and the intimate partner violence. In addition to the 3 modules, there is also one session about voices of those with lived experiences of family violence. You can see on this slide that the Vega curriculum integrates various delivery methods with instructional designs. The interactive scenarios also include different settings, like family practice clinic, mental health counseling center, and emergency department. In addition, the resources include handbooks, care pathways, and infographic material. Once you register on the site, you can access those materials with the password anytime you want. Now, Vega integrates TVIC into the practice and developed this EAR model. It is an easy way to remember, right? EAR. E stands for the environment that reminds us to create emotionally and physically environment for all clients and providers. It is only in a safe environment that we can start a trustful relationship with client. A is approach. Service provider need to realize that any client could experience or be experiencing family violence, and there could be deep impacts of trauma with it. Avoid re-traumatization. We don't need to know the details of violence. And pay attention to clients' voice and readiness of change. At the same time, emphasizes choice and collaboration with clients. R is respond. Be alert to not just physical signs and symptoms. Include also any red flags, risk indicators, health concerns, and patterns of behaviors, such as male partner who is unemployed, inconsistent history, mental health concern, frequent cancellation of employment, or unwanted pregnancy, etc. Inquire about family violence if indicated in a safe environment with privacy. Ensure immediate needs are met and provide a warm referral to evidence-based intervention as needed. Vega Family Violence recommends a phased inquiry which fit into TVIC principle. You can see here that the first step is to address clients' presenting concern. Once clients settle down, then providers can start asking general well-being questions, such as, how are things at home? How do you and your partners get along? Then providers may share their concerns and ask more specific questions based on the indicators that they observe during the interaction with clients. Of course, all these inquiries are asked in a safe space and confidentiality is ensured. Sample question could be, are there times when you don't feel safe at home? Sometimes a partner can say or do things that hurts a person emotionally or physically. Does it happen in your relationship? Once there is any disclosure of family violence, the WHO Lives Protocol can be applied to respond safely. That is, listen, inquire about needs and concerns, validate, enhance safety, and support. I can give you examples that something like that. Thank you for telling me what has been happening. Everybody deserves to feel safe. Have there been any significant changes in your partner's life, such as recent job loss or increase in use of alcohol or drugs? Has the frequency or severity of any harm you are experiencing increased? I'm concerned that this may be affecting your health and safety. What is your greatest concern right now? What has worked well for you in the past when facing all these challenges? If you need to leave your home in a hurry, where could you go? And how would you get there? Based on all the above inquiries, clients have the opportunity to voice out their concerns in a safe and trustful environment, while providers have a better sense about clients' needs and before making connections with other social support. So how do we do in the York region then?
Thanks, Angelina. So to bring everything we've discussed today together, we wanted to review how the practice of assessing and responding to family violence has changed at York Region Public Health. So we've implemented online VEGA training for all child and family health staff. We have offered follow-up sessions for frontline staff to role play and practice their new skills. We are currently creating updated policy and procedures for staff and are also updating our charting templates to reflect our new practice. And finally, we plan to complete a comprehensive evaluation of staff knowledge and confidence related to this practice change. And that brings us to the end of our presentation. Thank you so much for joining us today. And Angelina and I have included our contact information. So we're happy if you want to reach out after the presentation. We do have time to take some questions today, and the presentation will be emailed to everyone that's registered after as well.